I'm presenting the first report on the Federal University of Lokoja Teaching Hospital, SB 871. The Senate at its sitting on Wednesday, 23rd February 22, read for the second time the University Teaching Hospital Reconstitution of Board, ETC Act, Cap U15, Laws of Federation of Nigeria, 2004 Amendment Bill, 2021, SB 871, and refers same to the Committee on Health, Secondary and Tertiary for further legislative action. The bill, sponsored by Senator Smart Adeyemi, seeks to, among others, amend the University Teaching Hospital Reconstitution Board at Cap U15 Law of Federation to include the Federal University Lokoja Teaching Hospital, thereby giving the teaching hospital full legislative recognition. Mr. President, I will go to observation. Every institution needs to be backed up by an enabling law. It's against this background that this bill is before this chamber. As of today, training facilities in the health sector are inadequate for the current population and projected population growth for Nigeria, currently put at 3% per annum. Therefore, establishing additional teaching hospitals, the Federal University Teaching Hospital in Lokoja will address this gap among others. The bill seeks to amend the first schedule to the Principal Act to include Federal University Lokoja Teaching Hospital. By this amendment, it creates a legal backing for the Federal University Lokoja Teaching Hospital. Our recommendation, Mr. President, after a clause-by-clause consideration and the input from the public hearing, the committee submit that its recommendation for the passage of the bill be approved. Mr. President, I present the report on the other 4 bills, and I'll present it in a summarized form together to save the time of the Senate. Mr. President, distinguished colleagues, the Senate at its various sittings on Wednesday, 26 January 2022, Wednesday, 9th February 2022, Wednesday, 23rd March 2022, read for the second time the bills for acts to establish Federal Medical Center in Onitsha, Anambra State, Ijebu-Ode, Ogun State, Osogbo in Osun State, and Gada in Sokoto State. The bills are titled as SB 814, SB 379, SB 364, and SB 292, respectively, and refer all the bills to the Committee on Health, Secondary and Tertiary for further legislative action. The bills were sponsored by Senator Stella Odwa, Senator Laleka Mustafa, Senator Surajuddin Ajibala Bashir, and Senator Ibrahim Gobri. They seek to provide legal backing for the establishment of federal medical centers in Onitsha, Ijebu-Ode, Osogbo, and Gada, and equip, maintain, and operate existing facilities to provide for diagnosis, rehabilitation, and treatment of various medical conditions. Our observations and the objective of the bill as follows. Distinguished colleagues, from the presentation at the public hearing and memorandum submitted, the bills receive overwhelming support for the establishment of the various medical centers in the locations as mentioned, that is Onitsha, Ijebu-Ode, Osogbo, and Gada, as they will bring healthcare closer to the residents of the various locations and Nigerians in general. They will, among others, bridge the gaps in living standard of health, tackle the problem of overcrowding witnessed in existing primary and secondary healthcare services, and create access to healthcare for the people of the areas who are in dire need of adequate healthcare facilities. When established, these facilities will also provide tertiary care for the people of the people in the area and the neighboring communities. Mr. President, distinguished colleagues, the 4 bills seek to establish the Federal Medical Center with facilities for diagnosis, treatment, and rehabilitation at the tertiary levels in the various locations mentioned. They will also serve as centers for training of healthcare professionals and conduct advanced health research. Our recommendation after clause-by-clause consideration is as contained in the various reports submitted. In conclusion, Mr. President, distinguished colleagues, the committee would like to thank the Senate President, the Senate leadership, and the entire members of the Senate for the opportunity given to us to serve in this capacity. I so submit, Mr. President.
Have you presented all 5? Yes, any comments? Leader of the Senate Committee, the Constitution of Boards, etc., Act, Cap U 15 Elephant 2004, Amendment Bill 2022, and approved as follows. Long title as recommended, clause 1 to 2 as recommended, short title as recommended, explanatory memorandum as recommended. Is this a true reflection of what transpired in the Committee of the Whole? Thank you. The Senate and the Committee of the Whole also considered the report of the Committee on Health on the Federal Medical Center Osogbo, Osun State Establishment Bill 2022 and approved as follows. Long title as recommended, clause 1 to 26 as recommended, interpretation as recommended, short title as recommended, schedule as recommended, explanatory memorandum as recommended. Is this a true reflection of what transpired in the Committee of the Whole? Thank you. The Senate and the Committee of the Whole also considered the report of the Committee on Health on the Federal Medical Center Ijebu-Ode Establishment Bill 2022 and approved as follows. Long title as recommended, clause 1 to 26 as recommended, interpretation as recommended, short title as recommended, schedule as recommended, explanatory memorandum as recommended. Is this a true reflection of what transpired in the Committee of the Whole? Thank you. The Senate and the Committee of the Whole considered the report of the Committee on Health on the Federal Medical Center Gada Establishment Bill 2022 and approved as follows. Long title as recommended, clause 1 to 26 as recommended, interpretation as recommended, short title as recommended, schedule as recommended, explanatory memorandum as recommended. Is this a true reflection of what transpired in the Committee of the Whole? Thank you. Finally, the Senate and the Committee of the Whole considered the report of the Senate and the Committee of the Whole considered the report of the Committee on Health on the Federal Medical Center Onitsha, Anambra State Establishment Bill 2022 and approved as follows. Long title as recommended, clause 1 to 6 to 26 as recommended, interpretation as recommended, short title as recommended, schedule as recommended, explanatory memorandum as recommended. Is this a true reflection of what transpired in the Committee of the Whole? Thank you very much. Leader of the Senate.
Thank you, Mr. President. I move that the
Distinguished colleagues, a bill for an act to amend the university teaching hospitals, reconstitution of boards, etc., Act CABU 15 Laws of the Federation of Nigeria, 2004 Amendment Bill to establish the Federal University of Lokoja Teaching Hospital 2022, third reading taken, and the bill is passed. A bill for an act to establish the Federal Medical Center Osogbo, Osun State, and for related matters 2022, third reading taken, and this bill is also passed. A bill for an act to establish the Federal Medical Center Ijebu-Ode, Ogun State, and for related matters, third reading taken, and this bill is also passed. A bill for an act to provide the legal framework to establish the Federal Medical Center Gada, Sokoto State, and for related matters 2022, third reading taken, and this bill is also passed. And lastly, a bill for an act to establish the Federal Medical Center Onitsha, Anambra State, and for related matters 2022, third reading taken, and this bill is also passed. Congratulations, Leader of the Senate. Chief Whip.
Thank you, Mr. President.